Hi, I'm Rich Daly, and this is Fast Finance, your quick hit of the news and numbers that matter the most in healthcare finance. Up first, weird numbers. $137 billion. That's the annual estimated spending on state-directed payments, of which 84% goes to hospitals. Now for today's main story. Hospitals and health systems' capital expenditures in fiscal 2025 reached their highest level since the start of the financial crisis way back in 2008. Capex as a percentage of depreciation expense surged to 142.7% in fiscal 2025. That was the highest since it was 154.4% in fiscal 2008. All of those numbers are from the Fitch Ratings 2026 medians. Also of note, even the one-year increase was significant from 123.4% level in fiscal 2024.
Hospital capital spending, I would say, for some organizations is surging. It's becoming more selective, more strategic, harder to defer, right? When you think about Capex, hospital systems, right, are really being forced to decide which investments are truly indispensable.
That was James Kin, Managing Director for Forvis Mazars. He said the Capex increase he's seeing among client health systems is very organization-specific. Routine Capex focuses on aging physical plant and deferred maintenance. But other Capex targets have emerged to include adopting AI, migrating care to the ambulatory setting, increasing tertiary and quaternary capacity, and funding mergers and acquisitions. Capex for AI has garnered a lot of attention. Fitch highlighted spending on AI adoption as a response to existing and increasing labor cost pressure. As big of a cost driver as labor is now, however, Fitch sees it worsening with the ongoing retirement of baby boomer staff and increasing service demand from ballooning Medicare patients. But Kim sees AI as a labor cost driver in the short term since new labor is needed to implement AI in health systems.
On the flip side, right, there's still that question of, okay, is AI going to replace jobs? And I think that's still slow moving, right? So I don't think necessarily that many organizations are looking at labor savings as a cost cut initiative.
Several other industry trends also have juiced the Capex surge. One is competitive position. As more hospitals and health systems undertake mergers, that fuels the need for their market competitors to also look for consolidation in order to maintain their competitive position. Similarly, when organizations see their competitors putting more resources into AI, that also drives a need to respond with their own AI spending. A second factor is inflation. Health system leaders have seen since the inflation surge started in 2022 that every year they wait to build new infrastructure increases the cost of that project. That's according to Kin.
If you want to build that tower now, it's only going to be more expensive to delay that capital investment and make that investment 5 years from now.
A distant third is rate pressure. Although less of a Capex driver than consolidation, AI, and aging infrastructure, lower reimbursement is putting financial pressure on organizations.
And if you continue to see top-line pressures on reimbursement related to regulatory change, some organizations may not see a viable path forward financially, and therefore that's what is putting them into conversations around consolidation. Maybe an indirect way, regulatory and policy is indirectly maybe pushing some elements of why Capex is being driven a little bit higher.
And the Capex surge looks likely to continue. In a survey of health system executives earlier this year by the advisory board, 64% of executives said their organization is growing their capital expenditures. As hospitals and health system spending continues to rev into high gear, we'll keep an eye on the range of projects emerging and let you know any interesting trends and unusual directions we see. Now, before we go, just one more thing. A bipartisan working group of senators recently released a preliminary legislative draft that attempts to resolve some of the most disputed aspects of the 340B program. Key elements of the bill include replacing the 340B rebate model from the Health Resources and Services Administration with a third-party clearinghouse to collect claims-level data. Another is authorizing covered entities, also known as providers, to use an unlimited number of contract pharmacies. Another element is requiring that child sites are wholly owned and operated by the covered entity and meet a range of requirements. Another is adding criteria and codifying the definition of 340B patient, and implementing mandatory user fees for covered entities based on those organizations' total number of 340B prescriptions dispensed. That new bill is just one among a flurry of recent developments in the 340B space. Others include advancing federal legislation requiring 340B reporting, an appeals court blocking manufacturer rebates, and the announced relaunch of the federal 340B rebate program. Well, that's all we got for today. Don't forget, you can get the Fast Finance newsletter delivered right to your inbox every Wednesday. Sign-up info is in the show notes below, or you can go to hfma.org. I'm Rich Daly. Thanks for listening.